Hello and welcome back to my YouTube channel. In this video, we will be continuing a lecture series on the pigments of pathology, wherein we'll be discussing about the exogenous pigments and minerals as well as artifacts. And as always, comments, healthy discussions are always welcome in the comment section below because knowledge shared is wisdom gain. So let's go. We'll now start with the exogenous pigments and minerals. And as always, we'll go in a case-based discussion in order to have a better understanding of these pigments and minerals. So the first case, a 60-year-old male has a history of chronic cough and mild shortness of breath. He has a history of working in coal mines. Biopsy of the hilar lymph node shows these features. So as you can see here, there is some sort of a blackish pigment which is present. So what is a pigment highlighted here? The pigment highlighted here is nothing but carbon. So why is the history of working in coal mines very important? Because carbon is a pigment which is inhaled or ingested or implanted in the skin following industrial exposure. So, if it occurs in the lungs and lymph nodes of coal workers, it is called as anthracosis. So, anthracosis is the condition when it is present in the lung or lymph node of coal workers. So, pathological accumulation of carbon occurs in conditions like coal workers' pneumoconiosis. It usually occurs in the lungs and it also occurs in carbon monoxide poisoning. So, it should not be confused with melanin. Whenever there is a confusion with melanin pigment, you need to do the bleaching process that we discussed in the previous video. What happens in bleaching is the melanin, like we had discussed, will disappear, but carbon retains. Carbon gets retained. Moving on to the next pigment, which is silica. Silica is usually deposited in a condition which is called as silicosis. So, whenever there is silicosis present, it will present with a progressive pulmonary fibrosis. So, as you can see here, in the microscopic image, there is dilated alveoli. There is usually hyaline material which is present. There are fibroblasts which are seen. There is acellular collagen and then there are something called dust-laden macrophages. So, the next pigment is asbestos. Asbestos is always seen in a condition called as asbestosis. So, what is this asbestos? Asbestos is nothing but birefringent fibers of the magnesium silicate. It is nothing but birefringent fibers of magnesium silicate. So, whenever asbestos is seen in the H&E slide, it presents itself as a asbestos body. Now this is the asbestos body. This asbestos body is beaded. It is yellow brown and it is barbell shaped. With a proteinaceous coat. Now why is it yellow brown? This yellow brown is due to deposition of hemosiderin. Where does this get lodged? It gets lodged in the alveoli of the lungs. This is demonstrated by Prussian-Brew reaction. So moving on to the next, which is tattooing. So what are tattoos? Tattoos are nothing but these blackish pigments, and these are usually confined to the skin. Sometimes they may also be found in the lymph nodes or associated glands. In this, there is a condition which is called as amalgam tattoo. So what is amalgam tattoo? Amalgam tattoo usually occurs in the mouth, and this is due to introduction of mercury. How does mercury get introduced into the mouth, you may ask? Because of something called as dental amalgam. So this is due to dental amalgam, and this occurs as brownish black granules. We'll now move on to the next, which is called artifact. We'll now start the artifacts. The first artifact that we'll discuss is about formalin. Formalin is usually found as brown or brown-black pigments in blood-rich tissues. The blood-rich tissues that we are talking about are spleen or any vessels which have hemorrhagic deposits in them. It is always better to use the neutral buffered formalin in order to avoid these pigments. So neutral buffered formalin is always better. So how do you treat stained tissues which are usually stained with formalin? You treat them by using saturated alcoholic picric acid solution. So you treat them by using saturated alcoholic picric acid. So next is the malaria pigment. Malaria pigment, as you can see here, is found in tissues wherein it is affected with the malarial parasite. So this is the malarial pigment. This is also removed by saturated alcoholic picric acid solution. Whenever you treat malaria, the malarial pigments will get removed by itself. So next is chromic oxide. Chromic oxide is usually occurring in tissues which are fixed with chromic acid or dichromate containing fixators. This is usually treated by 1% acid alcohol solution. The next is mercury. Mercury, as you can see here, are brownish black pigments, and these are usually present in tissues which have been fixed in mercury containing fixators. This is usually treated with iodine solution. The next is starch. Starch usually occurs in tissues because of using powdered gloves. And these are usually PAS or GMS positive. The next is schistosomes. Schistosomes are usually seen in patients who have schistosomiasis. So this is the schistosome pigment. This is usually treated once the schistosomiasis gets treated. So once the disease is treated, the pigment goes away, just like in malaria. I hope you enjoyed this video. If you did, please like, share and subscribe to my YouTube channel, and I'll see you in the next video. Thank you.